Hello everyone, I am Dr. Shankar Dey. Today is fifth class of ECG. In this class of ECG, we are going to discuss abnormalities of QRX complex in ventricular hypertrophy. So today's topic is abnormalities of QRX complex of ECG in ventricular hypertrophy, in left ventricular hypertrophy and right ventricular hypertrophy. Those who have not subscribed my channel, please subscribe my channel for more videos on ECG. So before discussing the abnormalities of QRX complex in ECG, we are going to see normal QRS pattern in ECG. So what is the normal QRX complex pattern in ECG? So first we will look at this normal QRS pattern. So normal QRX pattern in different chest leads from V1 to V6 will be like this. Suppose this is V1, then this is V2, then this is V3, then this is V4, then this is V5 and this is V6. So this is normal QRS morphology starting from chest list V1, V2, V3, V4, V5 and V6, and as you can see clearly, as we progress from V1 to V6, the height of the R wave is increasing. So height of the R wave is increasing. See, in this case, the height of the R wave is much larger as compared to V1 in case of V6, and height of the S wave decreases as we progress from V1 to V6. This is normal QRX pattern in ECG. Normal QRX complex should not be more than 120 millisecond. So normal QRX is less than either 120 millisecond or in other words 3 small square. So in ECG normal QRX complex will be less than 3 small square or 120 millisecond. As I have told you in my first video of ECG, 1 small square is equal to 40 millisecond on zero point 0.4 second. So normal QRS will be less than 3 or small square or 120 millisecond. So this is the normal QRS morphology. As we progress from chest lead V1 to V6, height of the R wave increases and height of the S wave decreases. Now we look at the changes in case of ventricular hypertrophy. So this is normal QRX pattern. So what will be the changes in case of ventricular hypertrophy? First of all, left ventricular hypertrophy. In case of left ventricular hypertrophy, these changes will be exaggerated. That means in case of left ventricular hypertrophy, the height of the S wave will be the height of the S wave will be much larger in case of V1. So the QRX complex will be like this. As we progress from V1 to V6, the QRX complex will be like this. The QRX complex will be like this. So these are the changes in case of left ventricular hypertrophy. As you can see very carefully, the amplitude of the S wave is increasing in case of lead V1. As we progress from V1 to V2, the amplitude of the R wave in increasing in case of V6, and amplitude of the S wave is increasing in case of V1. So this is a changes in case of left ventricular hypertrophy. In case of left ventricular hypertrophy, S wave is much larger in leads like V1, V2, and R wave is much larger in V5, V6, these chest leads. So, and what will be the changes in case of right ventricular hypertrophy? The right ventricular hypertrophy changes will be opposite of left ventricular hypertrophy. In case of right ventricular hypertrophy, the height of R wave increases in V1. So the changes will be like this. So So this will be the changes in case of right ventricular hypertrophy. As you can see, the height of R wave is increasing in case of V1 and the height of S wave is increasing in case of V6. As you can see, in case of normal, the S wave is almost very small or almost absent in case of V6. But see, in this case of right ventricular hypertrophy, S wave is very large. So this is the difference of QRS morphology in case of normal rhythm, in normal heart, in case of left ventricular hypertrophy, in case of right ventricular hypertrophy. Now, how will you determine whether it is a left ventricular hypertrophy, right ventricular hypertrophy? In case of left ventricular hypertrophy, this SV1 is more than, either is SV1 is more than 25 millimeter, means this S wave will be more than 25 millimeter, or this R wave RV6 will be RV6 will be more than 25 millimeter, or summation of these two, means SV1 plus RV6 more than equal to 35 millimeter in case of left ventricular hypertrophy. But in case of right ventricular hypertrophy, what will be the formula to memorize, to uh, determine whether it is a right ventricular hypertrophy? R wave height will be, so RV1 will be more than, say, either R wave in the V1 will be more than 7, or either S wave in the V6 equal to more than 7 millimeter, or summation of these two, means RV1 plus SV2 more than equal to 10 millimeter. So this is the easiest way to determine or interpret whether there is any ventricular hypertrophy present or not, and if present, which side it is, either left ventricular hypertrophy or right ventricular hypertrophy. Now see this ECG carefully. In this ECG, this is normal ECG. This is normal ECG. As I have told you, in case of normal ECG, as we progress from V1 to this V6, the height of the R wave increases and F wave decreases. So see, this is V1, this is V2, V3, V5, V6 and V6. So as we progress from V1 to V6, see, the height of the R wave is gradually increasing. See, the height of the R wave has increased, but see here in this case, S wave is very large, but see in this case the S wave is very small, or it is almost absent or nil in case of V5 or V6 in normal ECG. So as I have told you, as we progress from V1 to V3, V6, the height of the R wave increases and height of the S wave decreases in case of normal ECG. So this is normal. See, now we'll look at the second ECG of today's class. This is our second ECG. As you can see in this ECG very carefully, this is V1, V2, V3, V5, V6. So in this case of BCG, as you can see, this wave is much larger. So this V1 is very large. So this SV1 is very large, S wave in the V1. And see, this wave is also large, means RV6 is also large. As I have told you, whenever the SV whenever the SV1 plus RV6 equal to more than 35 millimeter, this is left ventricular hypertrophy. Now let's calculate this. This is 5, 10, 15, 20, 21. So SV1 is 21 plus RV6. R wave on the V6 is, this is 4, this 9, 14, 19, 25, 26. 6. So almost 1, 2, 3, 4, 5, almost 25. That means the summation of these two is 46 millimeter. So as I have told you, if the summation is more than 35, it is left ventricular hypertrophy. So this is nothing but left ventricular hypertrophy or LVH. So in case of LVH, the height of the S wave increases in V1 and height of R wave increases in V6. So this is left ventricular hypertrophy. You can also find in association with LVH, you can also find left axis deviation or LAD. See, this is lead 1 and this is lead 3. The QRX complex is leaving from each other. So this is left axis deviation. I have thoroughly discussed in my ECG normal axis and axis deviation video. Those who have not watched the axis determination video, please go through the video to know how to determine the axis in the ECG. So this is left axis deviation along with left ventricular hypertrophy, and sometime you can also find out P mitrally in case of left ventricular hypertrophy. So this is the association along with left ventricular hypertrophy you can find out in ECG. In next ECG we will find out what is the pathology. So this is V1, V2, V3, V4, V5, V6. As you can see very carefully here, R wave is much larger in V1, in V2. So in this case, as you can see, this is 5, 10, 11. That means RV1 is 11 millimeter and SV6. See, this is SV6. SV6 is 7 millimeter. So as I told you before, whenever there is RV1 is more than 7 or SV6 is more than 7 or summation of RV1 plus SV6 is more than 10 millimeter, this is right ventricular hypertrophy. In this case, summation of RV1 is 11 plus 7, that means 18 millimeter. So this is a case of RVH or right ventricular hypertrophy. Right ventricular hypertrophy or RVH. So in case of RVH, height of the R wave is more in case of V1, and in case of V6, S wave height is more. As I have shown you before, in case of normal ECG, this S wave is very much negligible or almost absent in case of normal ECG V5 and V6. But see, in this case, S wave is much larger in case of right ventricular hypertrophy. From this point, you can also tell this is right ventricular hypertrophy because RV1 is more than 7 millimeter. So this is right ventricular hypertrophy. So in right ventricular hypertrophy along with ventricular hypertrophy, you can also find two another thing. What are those? One is right axis deviation. See, in this ECG, in case of lead 1 and lead 3, the QRX complex are approaching or reaching towards each other. So this is nothing but right axis deviation. So you will also find out right axis deviation in right ventricular hypertrophy, and sometimes you can also find out P pulmonally. In case of right ventricular hypertrophy, the height of P wave is much larger. So P pulmonally. So this is all about today's class. So how to calculate? Let's summarize. What is the summary? If there is any left ventricular hypertrophy, how to determine? In case of left ventricular hypertrophy, either S in the V1 is more than 25 millimeter or R in the V6 is more than 25 millimeter, or summation of these two means SV1 plus RV6 equal to more than 35 millimeter. Or what is about right ventricular hypertrophy? In case of right ventricular hypertrophy, either RV1 is more than 7 millimeter or SV6 is more than 7 millimeter, and or RV1 plus SV6 is more than 10 millimeter. So this is the summary of today's class. Just memorize these things. It will be very easy for you to determine whether there is any left ventricular hypertrophy or not. So this is all about today's class. For more such videos on ECG, don't forget to subscribe my channel Dr. Shankar Dey. So subscribe the channel and press on the bell icon for more videos on ECG. In the next class of ECG, we are going to discuss changes in the P wave. In today's class, we have discussed changes in the QRX complex. In the next class, we are going to discuss P wave abnormalities because of atrial abnormalities because of atrial hypertrophy. So, in the next class, we will discuss right atrial hypertrophy and left atrial hypertrophy and their changes in ECG in their changes in P wave of ECG. So, thank you very much for watching this video. For more videos on ECG, subscribe the channel and stay tuned for the next video. Thank you.